wanted to speak directly with Sore before he left. Right? He ran away. I'll find him somewhere. Alright, ladies and gentlemen, this is the reality. We have all lived, I probably lived longer than Sore in the United States, and I've lived more than half my lifetime there than here. I've lived here, the UK, the United States, I went to Canada. Don't go there and come and tell me you bring the same thing there here. I've said it time and time again, people, do not copy if you don't know how to paste. This is what all this, we've got copy there. This is our problem here, people. This is what I see in the NHS. They went there and copied the HMO and came here and pasted it wrongly. I have lived there, I've worked in the UK, I've worked in the United States, I know. Let's come back here and domesticate our issues. Right? So all this long English, forget it. We've lived there long enough. I didn't have to come back, I came back. Roll my sleeve to work for our people. You don't say, and this is what I hear everybody that lives there 2 years, 1 year, comes here and gives speech in Nigeria. This is what I found here in spite of all the failings of the NHIs, ladies and gentlemen, over the last 12 years. This is what NHIs has done. NHIs has increased access to healthcare for our people across all 6 geopolitical zones. I was in Ilorin recently. The largest private practitioner asked to see me in my hotel room. He came to me. He said, you will understand this because you are a pediatrician. The biggest killers of children are 5. Malaria, diarrheal disease, respiratory illnesses that can be prevented by immunization and malnutrition. These 5. Malaria itself does not kill children. What kills children are complications from malaria. He said, since NHIS came, and this is the kind of data we want to hear and see. Since NHIS came, I do not see death from children from severe malaria. The severe malaria, cerebral malaria, severe anemia, or severe diarrhea, and all the complications. And he said the reason is simple. Because mothers now know that if their children have malaria, they have access, they will run to come and see me. Whereas previously, when there was no NHIS, they would wait until this child gets really sick and they will bring this limpy child unconscious to my hospital. It's good to hear. Really good to hear. In spite of all our failures, we have increased access and we have increased death in many places. What is the NHIS doing? I know you asked a number. This is what I found when I came to the NHIS. People have seen a lot of healthcare elsewhere. This is not a perfect one, and I've not found any perfect one anywhere in this world. What we have here is what we have to make work. I'm not saying Harvard, I was in Harvard, I was in Seattle, I was everywhere in the world. The best centers in the world, and I met Nigeria. We're back home, in the trenches, in our villages, where our people act and make a difference. And not always say, oh, it's not there, it's not there. Yes, it's not there. We'll roll our sleeves. When I was a medical student 36 years ago, there was no hospital in this country that had an MRI. Now every corner they have MRI. We don't have equipment. You do not need equipment to work as a good doctor. You do not need people to do a cesarean section or neurosurgical procedure there. We are saying equipment. Let's roll our sleeves and work with what we have. What am I doing at the NHIS now? What I found, like I said, NHIS has not been anything, we've not been serving our people like we should have. We've not been the regulators we needed to be. And I am the first executive secretary of the NHIS that owned up to all this. If you do not own up to your fault, you will not fix it. We are fixing it. What have we been doing? There are 4 main stakeholders in the NHIS. NHIS is the regulator, HMOs, they are the middlemen we give money to take to hospitals, the hospitals, and the patient, who is the enrollee. lost in the shuffle. All these years lost in the shuffle. Just like in teaching hospitals, the nurse wants to be the chief medical director, the doctor wants to be the dentist. Nobody is talking about patients. Nobody is talking about patients. So also in the NHS, for the last 13 years, nobody has been talking about what the person we call the enrollee. I am the executive secretary that is putting enrollee in the driver's seat. What have we been doing? We are holding ourselves accountable and accept the fact that we've not been the regulators we needed to be. And that's why healthcare financing is the way it is now. And we're going to do better. Number two, HMOs. We've been giving them money to give to hospitals they have not been paying. What have I done? We are recently re-accrediting all HMOs nationwide. The one condition I put is that every HMO must present to me certificate of non-indebtedness signed by the hospitals they serve. If they serve 1,000 hospitals, go get me a letter that you're not owed. I'm very proud to tell Nigerians they are paying hundreds and hundreds of millions. And wherever I go, chief medical directors are coming to me and thanking me for empowering them. Whereas previously they would call HMOs, HMOs would drop the phone, will not pick them up. Now they are coming to beg them to receive that letter. Thirdly, what are we going to do? We are going to, in September, start re-accrediting all hospitals nationwide. Why? There are many hospitals in this country, particularly in Lagos and the Northeast, that are ghost hospitals. Have never existed or existed and are no more functional, but they've been receiving capitation. We're going to re-accredit them and plug the wastages. And then after that, we are going to put the enrollee at the driver's seat. Currently in Abuja, what I'm doing, I've deployed major hospitals in Abuja, people we call desk officers from the NHI. If a patient goes to a service point and he's denied or he's not been treated well, he comes to our desk officer. The desk officer will fight as an advocate for him. I'm going to replicate that all nationwide. And I'm going to. There has never been. This is what I realized, and this is the news Nigerians need to hear. NHI sustains all major tertiary hospitals in this country. But the money we give them on behalf of our patients. If NHI pulls up, all tertiary hospitals will collapse. So this is one way NHI has helped health services in this country. But we've never gone to any hospital nationwide NHI and asked them. Last year we gave you 100 million. What did you do with it? Account for it. Never been done. We are going to start auditing all hospitals nationwide and ask them to account for the money we give them. The money we give them is not to pay overhead, but to improve infrastructure for our patients to continue to be seen better. These are things we are doing, and we're very excited. Basic healthcare provision fund. And we're going to do it well. What I advise our contestants, and I want to see many more of them, talk to us. What are we doing? What is the NHI? What's our faith? What's our vision? We are partners and we're here. We came from wherever we came in this world to help our country go forward. We are all partners in this. And I, as the Executive Secretary of the NHI, the undertaking I give to all Nigerians is one, that I am going to be a good steward of that which I'm entrusted with, which is our people's commonwealth. And that's why we're here. So help me God. Thank you.